Hello friends, we all know that CBT, the cognitive behavioral therapy, is one of the very powerful therapy we all use, right? Many of the psychologists today use cognitive behavioral therapy during their counseling sessions and therapy sessions, right? So when we use cognitive behavioral therapy, to get the maximum benefit of cognitive behavioral therapy, we should know where to target, what is to be targeted while using cognitive behavioral therapy. So we know that the cognitive behavioral therapy, or we call it as CBT, works on a fundamental principle. What is that fundamental principle? The fundamental principles on which the cognitive behavioral therapy works is that, our cognitions will lead to emotional disturbances, and that again lead to the behavioral problems. So cognition, emotion and behavior. That is why we call it as cognitive behavioral therapy. So, CBT mainly focuses or targets three very important things here. So, the three very important parameters are what? One is our emotional experiences. The second one is, the physiological symptoms. And the third one is behavior. Whenever you use CBT to deal with the different problems, there is a common model which can be used by everyone. So, what is that common model, or you can say the CBT model, the very important CBT model that can use to deal with all type of problems? This is that model. So, according to this model, the maladaptive beliefs we all call as schemas can lead to maladaptive specific cognitions when attention is allocated to aspects of certain triggers such as situations, events, sensation, or even sometimes some thoughts. These attentional processes often show a high degree of automaticity and can happen at the subconscious level. So, once the process reaches the subconscious level, the triggers are evaluated and interpreted. This appraisal then leads to a subjective experience, a physiological symptom, and behavioral response. So, this is the general model of CBT. Here we have seen three importance are very, very important. One is our physiology, one is our subjective experience, and one is the behavior. So it works as a system together, right? So, but when you use CBT, either you can target it as a whole system, or we can target it separately, that is individually. That is the way we use cognitive behavioral therapy to deal with the different type of problems brought by our clients.